Hello and welcome to today's episode of the Aunty Pharmacist podcast. How was your weekend? Hope you had a nice time with friends and family. So today I'll be talking about a very common issue that's plagued society for a while now. Yes, as usual, there are issues to discuss. So without further ado, let me get right into it. The topic for today is the drug abuse cycle. Yes, the drug abuse cycle. Remember in secondary school biology, if I'm correct, how we learned about nitrogen cycle, carbon cycle, even water cycle, right? Well, there's a drug abuse cycle too. At least this one I coined by myself. But it's similar to those. You know how one thing leads to the other and comes back to the origin. The same thing happens with drug abuse. Did you know that? Well, I will let you know today. First, what is drug abuse? Drug abuse is the use of a medication for purposes it is not meant for, or in a way it is not meant to be used. That's the simplest way in which I can define it. There are other complicated ways, but I don't think that's necessary. The essence of this podcast is to explain anyway. So let me keep explaining. So like I said, when you abuse a drug, you either use it abnormally, in quote, for purposes which it's not meant for, or you do not use it the right way. So I would say that drug misuse leads to drug abuse. Well, we're coming up. I'm getting somewhere, alright? So there is something that starts this cycle, and it is called self-medication. This is practiced wildly, especially in Nigeria, by people. People have different reasons for it. Some people claim they do not like the waiting time in hospitals. They do not have money to spend on medications and consultations, so they prefer to just go to one chemist beside their house and let them do a kakpo for them. That's what they call it. They do not even complain about any case. They just go there, give me tetracycline, give me ampicillin, give me flagyl. They put it together and they go treat themselves at home. That's self-medication. You self-diagnose yourself and you treat yourself without actually consulting a qualified healthcare professional. And this is the root cause of the drug abuse cycle. It's the starting point. So self-medication, like I said, is when you do not consult a healthcare professional for your health condition, but you just treat yourself based on your own knowledge, or maybe because you've Googled it. We'll talk about that one in another episode, alright? So, self-medication is what leads to drug abuse or misuse because, well, you don't know what these medications are meant for, or even if you do, you may not be using the right medication for the right condition. So at the end of the day, you are abusing that medication. Because most people that self-medicate do not take the right drug for the right condition. Others do not take the right drug at the right dose. And these are conditions that must be met for a particular illness to be properly treated. The right person must take the right medication at the right time, at the right dose, for the right duration. That in itself is the complete holistic treatment of a condition. Not one you just, take as you like and you stop whenever you like. That is drug abuse. Now, this drug abuse or misuse leads to three major things. Number one is addiction. There are some drugs that one can get addicted to. Alright? Number two is therapeutic failure. And number three is increased morbidity. Number one, addiction. That's for drugs of abuse. Drugs that have abuse dependence and potential for addiction, like the likes of codeine, tramadol, cocaine, heroin, methamphetamine, LSD. These drugs are actually made to treat particular conditions and should be used under supervision of a healthcare professional. Opioids, especially. Some are very strong pain relievers and they have some effect on the central nervous system, that is the brain. Some are CNS depressants, some are stimulants. So you should use them after a doctor has prescribed them for a number of days. Alright? Common examples are the benzodiazepines like diazepam. A lot of people now are addicted to the diazepam. They cannot sleep without taking it. We shouldn't be, because it's supposed to correct a particular condition of insomnia in most people. After a while, some people now see it as a normal daily pill that they should take to sleep, which is wrong. It was supposed to be taken for a few days. Most times, it's not even up to a week, between 3 to 7 days, after which your body is supposed to reset itself and you sleep well. Besides, you're treating a symptom with diazepam most times, except for people who use it for seizures. You are not treating the cause. Most people that use this diazepam are people with high blood pressure, whose heart rates are so high that they can't sleep at night. So this thing is like a calming medication, a tranquilizer, a hypnotic to actually put them to sleep. But they get so used to it that every day now they want to use diazepam. They want to use Lexotan to sleep. You shouldn't be. The same goes for codeine and tramadol. They are very strong pain relievers. They are opioids, and they get transported to the central nervous system, the brain. So they are CNS depressants. They make you they remove pain sensation, straight from the brain. People now get used to it so much that even when the pain is gone and they do not need it, they go around pharmacies looking for kokodamo, looking for tramadol. We shouldn't be. People even use this tramadol for other reasons, especially the men. They mix it with so many things, so many unmentionable things to enhance sexual performance. This is abuse of medications. Same goes for cocaine. Cocaine is not even used medically, to the best of my knowledge right now. A lot of people now take it as inhalant, sniff it. They become so slow, they forget their sorrows for a while. They become addicted to it, same as heroin and methamphetamine. Things affect human behavior. If you do not take them, you start experiencing withdrawal symptoms. And just like the testosterone I talked about in the last episode, the steroids, those are methods of abusing medications, using them for purposes for which they were not made, using them for their side effects. That is drug abuse. I've talked about drug abuse leading to addiction. The next is therapeutic failure, and this is divided into two. Therapeutic failure can come in form of tolerance or resistance. All right. I talked about drugs one can get addicted to. There are others that work directly on muscles, especially pain relief medications. When you abuse them so much that you take them every single time, it gets to a level that their tolerance develops. Not even pain relief medications alone. There are some antihistamines too, anti-inflammatories, that after taking them consistently for a while, the body gets so used to it that you have to take extra doses to get the same action. It could happen with your usual paracetamol. It's not every case of headache that you have to use paracetamol for. I hope you know that. Your headache could be caused by stress. Maybe what you need is just a bath and sleep, and you wake up fresh, rejuvenated with the headache gone. It could be due to hunger. It could be due to a lot of things. It's not in every case of headache that you should just pop paracetamol. This paracetamol itself, as common as it is, has its own side effects, especially on the liver. I hope you know. There are medications like that it's always in your medications bag. It's what you pick first. Little stomach upset, you have picked tetracycline, you have picked flagyl. You don't even want to know the cause before you start treating the symptoms. That is in case of tolerance. It gets to a point that before you use a tablet and you're fine. Now you use two, you do not even see any effect. That is what we call tolerance. The second one under therapeutic failure is resistance. This is a great issue. It's a big issue right now. This happens in case of anti-infectives. Medications that you use to inhibit or kill microorganisms. It gets to a point that because you have been using this medication so much, these microorganisms develop resistance mechanisms. That's what we call them, resistance mechanisms, to circumvent the effect of these medications, such that when you use them, they do not work anymore. making it more difficult to treat these infections. Examples of such medications are antimalarials, especially antibiotic. People just use them anyhow. They don't want to know which one works for. People believe that ampiclox is a cure. You have unprotected sex, you quickly want to wash your system. That's what they call it. They pop one capsule and that's all. Little cough, ampiclox. Even headache, some people use ampiclox. And the consequence of this is antimicrobial resistance. About this, I will talk extensively in another episode. Let me quickly move to increased morbidity. This is as a consequence of therapeutic failure. Morbidity is the state of having a disease condition, especially if it's something that is transmittable, that can be transferred between one person to the other. For example, somebody has cough and he has abused medication so much that even when he did sputum analysis, all the medications, the bacteria is resistant to them. Then what happens? There is nothing to do. The disease condition continues. That's morbidity. And now this person is able to infect other people in this community with the same resistance strain of the bacteria. So there's increased morbidity. If only 2 people had the infection in the environment before, now maybe 10 more people will have it. Increasing morbidity. And this could lead to mortality if care is not taken. This increased morbidity results from therapeutic failure, right? I hope you are following my cycle. I've talked about how self-medication is the root of drug abuse. So the arrow goes from self-medication to drug abuse or misuse. Now, the arrow goes from drug abuse or misuse to 3 different places. The addiction, therapeutic failure, increased morbidity, right? Now, from therapeutic failure, 2 arrows go to tolerance and resistance. And another arrow from the therapeutic failure to increased morbidity. I've talked about how increased morbidity can cause mortality, right? That is death from treatable infections that are no longer treatable. Then, increased morbidity causes unnecessary spending. That's the economic implication. Because you start buying lots of medications when the ones you were using did not work. Because you have overused them, you have misused them, you have abused them. Then unnecessary spending leads to what? Poverty. Because you have spent your money that you should have used for something else. You have spent it on medications that were in the end not beneficial to you. Leads to poverty. And now poverty goes back to self-medication, the root cause of it all. You see why I call it a cycle? Because, well, if you don't really have much money, you will not be amenable to going to the hospital to see a doctor or to going to a pharmacy to see a pharmacist to give you medication. You would rather just go to one chemist and do a kakpo, or go and get an herb, a decoction or a concoction for yourself, or just enter and instead of consulting the healthcare professional, you are scared that they will give you one medication that you can't afford. So you just buy whatever comes to your mind in your attempt to treat yourself. You see? Then it gets back to self-medication and the cycle begins again. Do not forget that poverty can also lead to drug abuse. Yes, like directly, not even from self-medication now. It's poverty that leads people to, join gangs where they smoke stuff, they get into drugs. Poverty is one of the causes. Now you see the drug abuse cycle, what it causes. The best thing for you is to not start. Self-medication is not advised. Once you start it, this cycle can trigger and it can start. Before you know it, you are dealing with drug abuse or misuse. You are dealing with addiction. Now you know that addiction is not only for people that smoke crack or that take marijuana or that take heroin. Even for common medications, you can be addicted to them if care is not taken. Then the drug abuse or misuse can lead to therapeutic failure. It leads to resistance, increased morbidity, unnecessary spending, back to poverty, and back again to self-medication. So if you want to cut the cycle, the best thing is to always, like I always say, see your healthcare professional for your health conditions. They are trained, they are professionals. All right, you might be an expert in your own field, but leave your health to the experts. Your health is not something you should joke with or gamble with. It's not enough to Google symptoms and see suggested medications and believe that that's all you need. I've told you, in this day and age, there's no shame in telling a pharmacist that, please, I can't afford this brand you are giving me. Give me a cheaper brand. If it's available, they will give you. I want to correct this notion where everybody that comes into a pharmacy thinks that all the pharmacist wants is to make money off them, which is wrong. Of course, it's a business, but we are healthcare professionals too. When you go to your doctor, do you think that the doctor wants to make money off you, even though you have paid consultation fee before you saw them? So you should not think the same with the pharmacist. Ask for a cheaper option for your medication if you can't afford them. There will always be something that you can afford, at least, instead of plunging yourself into this vicious cycle of drug abuse and dealing with the consequences later. Well, this is what I brought to you today. I hope that you were able to gain something from it. It's from a place of concern for your health. I hope you take my advice and desist from self-medication. Enjoy the rest of your week. I'll see you on Friday. So till then, stay healthy and God bless you.